Hello class, this is Miss Evelyn with the CNM Veterinary Technology Program, and this is continuing the class for VT 1096 for Clinical Pathology, number 1, the lecture portions, and the microbiology. This is week 2. So today we're starting on the part 3 PowerPoint. You can follow along in the materials that you have in your class materials, and the PowerPoint will be also put on the screen. This is going to introduce various organisms, and especially the organisms that might be of great importance in the veterinary care area of medicine. Of course, a lot of these will also apply to human medicine, but this is actually geared toward the veterinary environment and organisms that we might see, and especially also species that those organisms may be very prevalent in or more commonly seen in. You will want to reference your textbook Unit 7 for some of the issues as we talk about this, the material this week, and also the Appendix B in your textbook. And that starts on page 406 to 416. It's not an item to actually memorize totally, but it is a reference to understand how you can actually locate different organisms and putting the material together from last week about some of the tests that they would be positive for and how you could locate those and use that wisely in a diagnostic plan. So we're looking at various organisms. Our first two that we will be breaking apart, and you may actually be able to outline this as the PowerPoint kind of starts splitting them up, is Staphylococcus and Streptococcus. So a nice medical terminology, coccus, makes you think of something round, cocci. Okay, so Staphylococcus and Streptococcus. And then the other two that we will be breaking apart on this PowerPoint is Enterococcus species and Enterobacteriaceae. So Bacteriaceae, that is a family name, when it ends in ACEAE. And entero should make you think of something about the intestines or the GI tract. Again, medical terminology. This is where medical terminology comes right into the coursework that you are doing. So Staphylococcus and Streptococcus. We will be splitting those two apart, and Enterococcus species and Enterobacteriaceae. So both Staphylococcus and Streptococcus are gram-positive cocci. Again, as we'll be showing forth in this PowerPoint, genus species. So genus species should be italicized. The first name here would be Staphylococcus would be a genus name. We'll be seeing some different ones here that will also represent genus species. So it's important to understand how genus and species would actually come into play. So Staphylococcus and Streptococcus. So Staphylococcus, so you were introduced to various tests last week. And now you're going to start seeing how those tests can play out as a diagnostic tool. So both of these are gram-positive. They stain purplish black. Some are a little bit in between, almost going a little bit to the reddish color, but they are gram-positive cocci. So one of the tests that you were introduced to last week was called the catalase test. And it takes just simple hydrogen peroxide and an organism, and if it bubbles up with the hydrogen peroxide, it is a catalase positive test. If it's catalase negative, there is no reaction. So if you were to have an organism in your veterinary office and you grew it out and you aren't quite sure which it is, but you know it's a gram-positive cocci, you could do a simple hydrogen peroxide test, and your veterinarian would know within a few minutes if you're dealing with a staph organism or a strep organism. So Staphylococcus, quite often we say they look like little clusters of grapes under the microscope. They may be a nice big cluster or smaller clusters, but we call them grape-like clusters. They may have 4 or 5 cocci together, or they might have 10. But we call them grape-like clusters quite frequently. These are also isolated quite often from pyogenic or infected lesions, wounds, such as also dermatitis issues, otitis issues, mastitis, cystitis, and osteomyelitis. Now, if you don't know where all those inflammations are, ITIS, go to your medical terminology and figure out what dermatitis is, otitis, mastitis, cystitis, and osteomyelitis. And you may want to practice saying those words with me as we go through the PowerPoint. So Staphylococcus, catalase positive, that hydrogen peroxide test will bubble on that test, and it is grape-like clusters. Streptococcus, on the other hand, is catalase negative. So simply by doing the one very simple test with a reagent that every animal hospital has around, hydrogen peroxide, you could help your doctor know if you're dealing with a staph organism or a strep organism. So Streptococcus is quite often seen within singles or in pairs or very short chains versus the typical Staphylococcus grape-like clusters. So chains, maybe diplococci might be together, meaning 2, or they may be some small little pairs or something on that order. These are quite common in equine medicine, again, pyogenic infections and mastitis in all animal species, and Streptococcus tends to be species specific. So it may not cross over from one species to another quite as much as staph would. So you should understand Staphylococcus, both gram positive, catalase positive for Staphylococcus, catalase negative for Streptococcus, and that they are the grape-like clusters, singles, chains, pairs, and that quite often strep might be species specific. Now we're going to break these down. That's why I said sort of an outline approach might be helpful in your additional notes, because now the next several slides are going to talk about Staphylococcus. Okay, so this is the second most isolated clinical organism after an Enterobacteriaceae. Again, Bacteriaceae, A-C-E-A-E, this ending, that means it's a family, okay? So A-C-E-A-E, all right? We're talking about Staphylococcus as genus, so it's italicized also. So staph, and you hear about staph all the time, it's widespread in nature. It's normal on our skin. And fortunately, our skin, unless you have a wound that makes a cut in your skin, is a very great barrier to having staph get into you or into an animal. So it is a very normal skin flora. But if it gets into someplace else, then on top of the skin, into a wound, into a deeper abdominal wound, it can cause tremendous issues. And it's sometimes hard to determine the clinical significance of Staphylococcus unless there are classic signs of disease. And remember, in animals, we talk about signs of disease rather than symptoms, because that animal cannot talk to us like a person can say, I have a cough, I'm feeling a tight chest. The animal has a sign to us about that. Remember to keep those words separate for our animal kingdom. So staph toxins, that is quite often the problem with the staph organisms, is that they cause exotoxins. And again, your textbook will highlight some of this. And again, in Appendix B, you may find some notes. There are several of the notes in this PowerPoint that actually you will not find in the textbook, because the textbook does not go as deep into the individual organisms as these two PowerPoints, Part 3, and then subsequently Part 4 will. Okay, so, but the toxins are actually the problem. They're coming out from the bacteria or from the place where the bacteria is causing the issue and causing a toxin, and that is actually the problem rather than the bacteria themselves. That's what happens in the case of food poisoning, toxic shock syndrome, which is an issue for especially ladies if they are having using feminine care, and the staph from the outside gets into the inside organ area, and it's toxic shock that actually then causes the fever, the illness, and all the other complicated problems. And you can have scalded skin syndrome. So many staph species are resistant, though, to multiple antibiotics. That's where we have the staph resistance. And Micrococcaceae is also a staph, but the DNA test, so I'm sorry, this is a typo up here on the slide, that should be also a staph. But DNA tests differentiate it from the staph. So it used to be considered staph, but Micrococcus species, so again, genus name is Micrococcus, and various species, and in this case SPP, would represent species, and those are both capital letter in the genus, small case first letter in the species. That's important for spelling, okay, for spelling purposes. So catalase positive is the Micrococcus are, and that differentiates them from strep. So it can be found in the environment, and some of the species of Micrococcus produce a very carotenoid pigment, yellowish pink, like carrots, okay, when it's grown out. Remember in my layout of the PowerPoints, when something is in bold, such as reptiles, you're going to want to make a note. Micrococcus can be really affected quite often in with reptiles. And they are resistant, if you're going to run an antibiotic test, to the disc, an FX disc, which is furazolidone, or your furazine kind of antibiotics. But the Micrococcus is resistant to it, so you wouldn't even, if you suspected that, you wouldn't even want to include an FX disc. Or if it is resistant to it, and you had that on your antibiotic Kirby-Bauer test from last week, then you would know, hey, you know, I may be dealing with Micrococcus. And there's several other tests that can differentiate Micrococcus from Staphylococcus. So again, we're talking primarily in this section of the PowerPoint about staph, but we wanted to bring in the discussion about Micrococcaceae. Again, the family name Staphylococcaceae, that ACEAE, that's a family name. Staphylococcus in the italics becomes the genus name. Again, catalase positive, these differentiate them from the strep. And again, most often, staph is susceptible to furazolidone. So if you were growing it out on a antibiotic Kirby-Bauer test, you would see that if it was resistant, then you may be a Micrococcaceae. But if it was susceptible to the furazolidone, then it could be a staph. And that's how you make the use of some of these tests that were introduced last week. Okay, we're going to, so that was dealing with the difference of Micrococcaceae and staph, and again, it's a DNA differentiation between those, and they used to be lumped together, but they are now kept separately. So Staphylococcus species, and again, genus name, capital S, Italics species will be a small name, like we have Staphylococcus simulans. So the S is small case for the species. That is critical when you're writing them out. If you are writing them by longhand, you would be underlining your genus and species. If it is in a text, it should be italicized. Staphylococcus species, genus, species should always be italicized if it is in a typed text. If it is in handwritten, genus, species should be underlined. So there are approximately 17 species of staph that are found in our clinical specimens. You need to know all of them. Well, not quite. All right, we will be highlighting some of those, but just know that there are a lot of different staph out there. And again, it is a normal flora of the skin and our mucous membranes. You probably have it in your mouth even right this moment, and probably on top of your skin, and your dog probably has it on their skin someplace. It is just all around. And again, if it stays in the normal flora area, it is not a problem. But when it gets into a wound, into the abdomen during a surgery, any of those kind of situations, then we can have a big problem from our staph. And again, humans that are in close contact to our animals might become infected when some of those with some of the animal-related species. So again, they are species specific, or can be species specific. But again, sometimes they can cross over and cause problems to a different species. So we have approximately 17 different species. One of those is Staphylococcus simulans. If you were making notes, I would just remember that staph, simulans, chickens. That is the species of our main. They're often colonized on the external tissue of chickens, and that might be one of the reasons that if in a food processing plant, you could have a staph issue that might cause then food poisoning or something on that order, because the staph got on top of the chickens during food processing, because it's just out there in our normal chickens as they're in their coop. The most clinically relevant is Staphylococcus aureus, A-U-R-E-U-S, Staphylococcus aureus, and Staphylococcus epidermidis. Does dermidis make you think of an area that it might be? How about on top of the skin? Epi, on top of. Dermidis, pertaining to on top of the skin. Again, meta terminology just breaks these apart. That is why medical terminology was a foundation for coming into the program classes. So these are the most clinically relevant. So Staphylococcus aureus. So again, if you were to do an outline, now this slide discusses Staphylococcus aureus. And we'll break apart some of the various staph. And then we'll get to our strep. So Staphylococcus aureus is the most important human pathogen among the staphs. Okay, it's found in the environment, and it causes significant opportunistic infections. So opportunistic infections, from skin infections to systemic illness. And it causes all different things. So again, in my outlining, really follow the items that are underlined or in bold. So Staph aureus is most important human pathogen, causes significant opportunistic infections. Okay, so sort of secondary. So folliculitis, impendigo, post-surgical wound infections, that's really critical as in our animal care. And community-acquired staphylococci bronchial pneumonia. Okay, so communal acquired. We might have a nosocomial pneumonia. So what does the term nosocomial? Think about what that term means. It means acquired within a hospital kind of environment. Nosocomial pneumonia And we, even our animals might get that if they were in critical shape and the staph got to them in the wrong spot or post-surgically or into their bronchi, and they could end up with nosocomial, hospital-caused, in a sense, pneumonias. Bacteremias with Staph aureus may lead to endocarditis. So again, endocarditis. All of these lovely medical terminology terms. If you can't figure them out, go back to your medical terminology book and figure out endocarditis. Has something to do with the heart, right? The tissue around the heart. Staphylococcal meningitis. So again, inflammation of the meninges can occur from trauma. And again, Staph aureus produces an enzyme coagulase. So that was also one of the tests that were mentioned last week, was the term doing a coagulase test. And Staph aureus is positive for coagulase, where Staph epidermidis, which was mentioned on the previous slide, is what we call coag or coagulase negative. So again, that would be how you could differentiate if you thought you had a staph organism, it was catalase positive, and you may think, where did it come from? That can be really critical. And also, if you can do a coagulase test at your office, then you can differentiate between Staph aureus and then what we also say, coagulase negative staph, CNS. We'll talk about that on the next slide also. But in this case, it does not mean central nervous system. It means coagulase, C-O-A-G-U-L-A-S-E, coagulase negative staph. And quite often, unfortunately, Staphylococcus, and especially Staph aureus, is resistant to penicillins and ampicillins. So again, in a hospital situation, if you were able to help with the doctor and do the couple simple in-hospital tests, the catalase test with the hydrogen peroxide, and if you had the availability to do a coagulase test, then you might be able to say which one, potentially which one it is. Possible. And without being in a diagnostic laboratory situation, you would always say it is potential, it is possible, it is a probable identification. But they would maybe choose a different kind of antibiotic because a lot of Staph aureus is negative or resistant to our penicillins and ampicillins. So here's our CNS, coagulase negative staph. Again, nosocomial infections coming from the hospital area, what we might call community-acquired UTI, urinary tract infections. We might see that, and especially also in the human world. This might be a cause for coagulase negative staph around infections of indwelling catheters. So again, sterile procedure, how well you prep the area to put your catheter in, because remember, staph is on the skin. So without a proper procedure for cleaning where you're going to be putting the catheter, that indwelling catheter, you may end up actually causing an infection in an animal that didn't even have one. Bacteremia in immunocompromised hosts. So again, with an animal or a person, but an animal in our world, that it has an immune compromised system, they may end up with a bacteremia in their bloodstream much more readily than somebody who has a really good immune system. Endocarditis can come from a coagulase negative staph. Post-surgical wound infections, prosthetic devices, and trauma infection. So one of the reasons that you really need to always disinfect surgical instruments and anything that's going to be left going into the animal is that especially coagulase negative staph can be very hard in a sense to totally get off of, scrubbed off of surgical instrumentation, or if a prosthetic device was not sterile when it went into the animal, you could be putting an infectious staph into a knee or a bone pinning or something on that order. And again, trauma infection. So you're closing a wound area over. You might be actually enclosing a staph inside of that may, inside of the wound area, that may cause critical issues later on. So remember, Staphylococcus epidermidis was one of those other organisms. Again, genus, species, appropriately italicized with the species being in a small case letter. This is our most frequent coagulase negative staph in our animal world, Staphylococcus epidermidis. And it produces what's called a slime layer, so highlight that with that name. It produces a slime layer, or what they call a biofilm, that enables it to stick to your surgical and prosthetic devices. So again, if you do not do add an appropriate cleaning of your surgical instruments, that's why you had surgical technology prior to this course, to understand about sterile procedures and the need to how to appropriately clean and properly clean and disinfect and autoclave your surgical instruments. If you do not do that properly, you may end up with a staph organism being introduced then to another patient. You do not want to be the cause of that. So Staphylococcus identification, okay? So Staphylococcus identification. It is a gram-positive cocci that tend to be in different sizes and clusters. It might appear in pairs or tetrads, so trios, tetrads. You would actually then report it on your gram stain as gram-positive cocci, suggestive of staph. Unless you were in a full veterinary diagnostic laboratory that could really verify the genus species, you're always going to say suggestive of, or probable, or potential, most likely, but some kind of word that gives the idea that this is not an 100% diagnostic case. So suggestive of staph. The textbook mentioned your hemolytic or hemolysis patterns last week. So on the sheep blood auger, that's where you check for your hemolysis patterns. Staphylococcus may have a beta hemolytic formation. And again, you can see your textbook about that, and there will be a document that actually will be also uploaded that will highlight how those look, how the difference between alpha, beta, and gamma hemolysis. And again, Staphylococcus catalase test to differentiate from strep, so catalase positive, and coagulase test to differentiate from Staph aureus. So this is sort of a summary slide. I'm going to do one more slide, and then we will pause on the recording and start another section. So Streptococcus, so remember Staphylococcus and Streptococcus, belongs to the family as Streptococcaceae. Again, family name. Typically, that is not italicized. This is gram-positive cocci in pairs or chains. They might be sort of oval shape. Remember some of in the first part of the textbook in Unit 7, it mentioned that sometimes they kind of go pleomorphic. They'll go a little bit in different shapes, and it's not a real nice circle. So sometimes a little bit oval shaped, but still very gram-positive. It is catalase negative for strep. That differentiates them for all of the staph. That simple hydrogen peroxide test. It is a really neat test to watch when you're able to do that in person with it. And hopefully You will be able to see that later on in your hands-on lab time. It is now what we also call oxidase, so another test that you can do, oxidase negative. It would be a glucose fermenter because it produces lactic acid. So Streptococcus, gram-positive cocci, gram in pairs or chains, produce lactic acid. And it may be with strep that they're called facultative anaerobes. They kind of like to be in a little bit less oxygen-rich environment, may not be totally anaerobic with no oxygen, but they grow better. They're facultative. They really like maybe a little bit less oxygen. So they might grow better under anaerobic kind of conditions, or we use a candle jar where it increases our CO2. Again, it is literally a jar where the petri dish is placed inside of it that was inoculated upon. You put a candle inside the jar, you light the candle, you close the lid of that jar, and the candle goes out. What did the candle just do? Use up most of the oxygen. So now we have an increased CO2, and that strep may actually grow better in that environment. And some strep can be classified by the cell surface carbohydrate antigens. And these were called Lancefield groupings, named after a Dr. Lancefield that discovered this. All of these groupings, so there are a variety of groupings, but the A, B, C, F, and G Lancefield groupings are all beta hemolytic. So you notice there's not a D and an E listed. So they are not necessarily beta hemolytic. I'm going to pause the recording at this point, and we'll break it up into a couple sections.